like the issues I was having with my heart. And I told my doctors this my whole life. It felt like, still feels like sometimes if I bend a certain way, like my heart gets stuck on something. And like if I do a lot of physical activity, sometimes it can happen. It's really weird. Like it's not one thing all the time that sets it off, but I did notice that it definitely can happen sometimes for me bending a certain way. And I can't even like make myself do it. Like it just happens. I'm bending a certain way and it happens. It used to happen a lot when I was getting out of the shower. Um, but I've heard that people have passed out. I got really strong palpitations basically. I could see my heart beating. It would move my clothes. It was so strong. And totally forgot what I was saying. So back to the pulmonary doctor. Um, no, back to my health history, sorry. When I was in the Army, one thing I did notice is that the more we ran and the longer and faster we ran, everybody else, it got easier for them, but it was never like that for me. It always was just as hard as when I first started. Like running just never got easier. I never felt like I could get enough air. And I remember even like training on the side with one of my friends, and he was a really good runner, and asking him like, can you watch my breathing, can you tell me what I'm doing wrong, like tell me exactly what you do when you run, because I couldn't, it just didn't make sense to me that I still felt so horrible running, like my lungs just I didn't get enough air. And so when I went to the pulmonary doctor, they were asking me a bunch of questions, and I told them all these different things that I had going on. And so when the pulmonary doctor comes in, he brings in the nurse practitioner, and I knew that probably wasn't a good sign because, they both have their own patients and things they should be doing. And so he pulls out the CAT scan that I had in November, and he lays it on the table, and he said, there are a couple things I want to talk to you about. And the first one is your CAT scan. I found something on your CAT scan, and it's something called a sequestered lung. And basically, the sequestered lung is something that I've had my whole life and never knew about it. And that's what's causing me to get pneumonia right now. And basically, it gets a blood supply, but it doesn't get oxygen. So right now, it's just collecting mucus and getting infected and causing me to get pneumonia. And it's not going to go away. I'm just going to keep getting pneumonia. So he told me that not right this second, but within the next few months to a year, I really need to think about having it removed. So it's a surgical procedure, and if I have the Nuss procedure, it can be done through the same incision, and they use a scope, and it's not as invasive as having your chest cracked open for the other surgeries, although they can do it that way. But yeah. So then he shows me on the X-ray and also on the CAT scan where my heart is being pressed in between my chest wall and my vertebrae. And so he said it probably was true that my heart was possibly getting stuck on something. And I actually requested while I was in the office that day, because I knew it would be easier to explain to my family when I got home what was going on if I had that CAT scan, because if he didn't have that to show me, it would have been a lot more difficult to understand. So let me grab that really quick, and I'll show you. Okay, so this is my CAT scan, and let me see. So all healthy lung tissue, I can't see, healthy lung tissue over here, healthy lung tissue over here. This whole little mass right here is the sequestered lung. Sorry, I'm not really looking at this. It's hard to... point it out. So that's what needs to be removed. And then you can see this is my heart, and it's right up against my chest wall and down here, like touching almost the vertebrae. And you can also see, which is kind of neat, the pectus excavatum just right here. It shouldn't be that way. If you look up a normal CAT scan, this looks totally different. And it's more, this is actually the left side, and this is the right side. And it's more compressed on the right side. There's not as much room. So from the lung functioning test that they gave me that day, the pulmonary functioning tests, they found out I only have, because there's not enough room in my chest cavity for my lungs to expand, I only have 80% of the functioning of my lungs that I should have. And so it's causing, the pectus excavatum is causing me problems with my heart and my lungs. And, you know, he looked at it and said, yeah, insurance will definitely cover this for you. And I got really upset because I started thinking about how I knew this was probably a pretty major surgery that we were talking about. And like my first concern was having a scar, a giant scar down my chest. And I started crying when I thought of that. And tried to dry it up really quick because it's really awkward for everybody in the doctor's office when somebody starts crying. I know, because it happens to me all the time in nursing school. But yeah, so basically that's what happened. And then he said he was going to refer me to a surgeon. And so he referred me there at the hospital. I go to Wright-Patterson Air Force Base, the medical center there, and they're really great. I love it there. It's a really nice place, and all of the doctors that I see, I absolutely love. They're wonderful. So they send me last Wednesday to the thoracic surgeon that they have there, and he was super nice, and they all tell me, you know, you're like my family. We're going to get you the best care. We promise we're not just going to send you to anybody. So basically he couldn't really tell me anything because he's not going to be the surgeon doing my surgery. This isn't the type of surgery that they would do there. They have to send me out. They don't even do it. I live in Dayton, Ohio. They don't even do that type of surgery anywhere in Dayton. So they're referring me to the University of Cincinnati Hospital. So I haven't gotten a call from them yet, but I will, and I have to have, let's see, they've already called me to schedule an echocardiogram because they want to check my heart again before they send me to the cardiothoracic surgeon at UC. And I got a phone call today from a cardiologist to set up an appointment, but I was at my clinicals, so I didn't get the phone call until it was too late. So I'll be calling them tomorrow to schedule that.